We're in the midst of a devastating gun violence crisis in this country. Firearm injuries have been the leading cause of death for children and teens in this country for 3 consecutive years. And, frankly, that's just really an unacceptable reality. And so Agree to Agree is a campaign that unites health systems and hospital systems across this country. And we're talking red states and blue states, rural, suburban, urban, to bring urgent action and really looking at tangible, nonpartisan things that each of us can do to really start to make a difference. And so we call it Agree to Agree because this campaign is grounded in the understanding that even on an issue like gun violence, where it could be seen as pretty divisive, that there's actually already a lot that we agree on. And especially when we're talking about children at the center of it. And so what we are releasing now on this campaign is really the first phase of this effort. And there are 2 parts. One is talking to parents and those with youth in their lives. And then the other is really talking directly to clinicians, so to healthcare providers who are really at the front line of the crisis, like Dr. Prince is, and are very much trusted by the community and by families across the country to provide collaborative care and personalized care so that we can keep our community safer.
I've been a pediatric surgeon and a trauma surgeon for 25 years now. And something as devastating as the loss of a child, especially to firearms, is really front and center for someone like me in my professional life. And really partnering with the Ad Council, when you have something that's so important that you want to trust that the messenger is there to convey the right message, that we're not partisan, that we are all here together. We are worried about the well-being of children, and we are here about advocating for their health and their joy in life, looking down the line. And so really putting all that together, how could I not, and how can any of us not jump into this conversation? It's a fundamental issue of health and well-being for again, from my lens, for our children, but this is true for all of us as Americans. As physicians, as healthcare providers, we see the devastating impact in an individual, as a surgeon physically, and for many of us as providers on the entire family and the whole community, and what one bullet in one moment can do to a person in crisis, to a person who finds themselves in a challenging situation, to a child who picks up a firearm and unintentionally discharges it because they're 3 years old and shouldn't have access to a firearm. I think we can all agree on that a 3-year-old should not have access to a loaded firearm. Let's start there. There's studies that show that just telling people that we care about access to a firearm and that it's safely cared for, stored, and that children or those who are in a moment of crisis won't have access to it, just showing as a physician that you care makes people think about it, brings it front of mind, and impacts their behavior. So I don't need to do an extensive survey. I don't need to have people tell me whether they have a firearm at all. I just need to signal that their well-being and safety matters to me. And that if I say that, and that if they have a firearm in their home, to please make sure it's locked, please make sure it's safely stored, please make sure it's not unloaded, that it's not loaded, and please make sure that someone that shouldn't have access to it shouldn't have access to it.
Yeah, so HCPs can go to our website, which is agreetoagree.org. And we have a separate section for healthcare professionals. So it's agreetoagree.org/healthcare. And there they can really learn about, kind of what Dr. Prince was saying, which is the unique role that clinicians have to help to prevent firearm injuries through non-judgmental, really collaborative, productive conversations with their patients and their families. And some of the resources that we have on the website really includes research around just the scope of the issue, programs and guides on how clinicians and HCPs can really start to have the conversation to reduce firearm injuries and deaths. And I think it's important to note that, this is just the very beginning of our campaign. So we are looking at a multi-year, multi-phased approach. So in the weeks and months ahead, we're actually going to be creating, rolling out additional resources to clinicians, and more importantly, building out the website, so agreetoagree.org/healthcare, to include even more resources and information information. So it really becomes a robust digital resource hub that HCPs can go to get educated, but also learn how to really have productive conversations with their patients and families that they care for.